In Saskatchewan, we've implemented the client and provider registries, the pharmaceutical information database, which contains the drugs for all people in the province. We're in the process of implementing a single PACS repository for the province and rolling that out region by region. And we've implemented a lab results database that has about 85% of the lab results in the province, and we're simply adding more labs to that sequentially. Certainly the delivery of lab results, physicians are very, very keen on that and very appreciative that they can get lab results now much more quickly and in electronic form. Certainly our PACS initiative has been very well received. People are delighted that we can now capture images electronically into one provincial database that then can be accessible. Very important where patients are being referred from one part of the province to another, especially in emergency situations. We're currently just passing 40% in terms of the adoption of EMRs, which is huge progress compared to where we were a couple of years ago. We were probably in the 10% range. And we expect to surpass 60% by the end of this year. So the program's really getting strong adoption by physicians, and it's a great partnership that we have with the Medical Association, who's out there working with physicians to help them implement, and we're doing our part by ensuring those systems meet standards and will integrate with the EHR. Our next step is to begin to move towards e-prescribing, and it's the connection of the EMRs to the EHR, I think, that's really key in terms of EHR adoption, because it gives us a wide audience of clinicians at the front lines of care that now can take full advantage of the EHR in a very effective way that's integrated with their local patient record. Interoperability is key to this whole concept of supporting the continuity of care and hence a more patient-centered approach to care. One of the key areas with interoperability, there's a technical component, but I would say the largest component is the whole issue of standards, working with care providers in terms of recording information in consistent ways such that it can be shared, and we have what we call semantic interoperability. In other words, as we connect points of care, that care providers have the same understanding of the information. We've traditionally been further behind with respect to systems in physician offices, but I think we're rapidly catching up now with the EMR initiative. I think many countries admire our vision in terms of the blueprint, in terms of our vision to how all the components as we build them will fit together. And I see many countries now starting to look at how they interconnect the various components of the eHealth agenda that they've developed. So, we're all learning from each other in this process, and it is a journey. And I think, Canada's made some good progress.